Hi everybody, Dr. Qazi over here at Qazi Cosmetic Center. I'm a skin restoration specialist in Newport Beach, California, and I focus a lot on acne, on scars, pigmentation. I do a lot with facial balancing as well, and I wanted to actually show one of my favorite results, which is with the under eyes, because I had a lot of questions about that. Actually, recently, a lot of patients have come to me over the last couple weeks, and they've been talking about the fact that they have some hollowness under their eyes, and they just found that this year they looked a little bit more sunken in, and they're trying to get some solutions for that. So I go through everything. I want to double check to make sure that it's not just due to pigmentation, if it's not just like a vascular issue. Those are all things that require different solutions. In this case, this was really true hollowness. This really was the fact that there's fat loss in the mid cheek and in the under eye area. And in order to fix that, we have to actually give a little bit of volume, a little bit of filler. So this is a good example of somebody who really could benefit from volume. And it's important because I know some people will say that you should never do the tear troughs, never touch it or anything like that. But in select cases, if there really is true volume loss and you don't have an excess amount of swelling underneath the eye, from like allergies, for example, things like that, then it's a really, really great procedure. It looks amazing actually for the right patient. And like people love it. It's just some people do it too superficially, some people put too much in there, and that's when you can run into a lot of problems. So there's a way to do it. It's just we got to be very, very careful with it. A lot of times they go deep down to the bone as well, in the tear trough area, so that way we can support that under eye ligament. So you can see in this case, that's what we did. Beautiful effect, actually, really, really wonderful. And pretty happy with it actually overall, because it's like one of those, the under eyes are one of those areas where it doesn't require too much filler, but a little bit of it could just go a long way, just refreshing patients. It's really nice. So, I do recommend though, especially for this patient also, we had to put a little bit in the mid cheek and then we put it in the under eye area. So a little bit over here to support the ligament and make sure that when we place some volume in the under eye area, it's going to look really cohesive. And so that's what we ended up doing here. So I wanted to go through today also with a lot of patients have been asking, like, when do you do PRP? What do you feel about like PRF? I see Kushi's asking, how do you feel about Erbium on the under eye area? So let's go through that as well. Also, like, when do we use Morpheus8? There's so many different options and you hear so many different terms and there's so many different opinions of these things. And so it's worth going into, and then also kind of addressing, when do you consider doing surgery? Like, what should we do for what cases should be surgical instead of even touching it with any filler? And let's talk about all those things. So Erbium is actually awesome for the under eye area for the right patient. If it's more like texture issues, you could do Erbium. And then if you want to do something where you want to get more skin tightening, then that is somewhere, that's a place where Morpheus8 can work really well. You don't want to bulk heat, don't want to go too strong with it, but a little bit for some skin tightening could work really well. Or you could do a CO2 laser if the patient's the right, the correct fits for it. So Fitzpatrick 1 through 4, you potentially do a CO2 laser there. Hey, is Leo saying, does Accure help with resurfacing as well? No, it doesn't help with resurfacing, but because it's normalizing your oil production, you do find that a lot of patients will say that their scar diameter has shrunk. They are noticing their scars a little bit less. You do get a bit of a collagen response as well from that. The amount of oil, sometimes it's so oily that it's an inflammatory process and you don't develop as much collagen as you normally would. So that's why controlling that oil allows you to actually stimulate some more collagen production. So Accure by itself is not something for resurfacing. It's not considered resurfacing at all. In fact, the surface of the skin really does not get affected. It's really just targeting just oil glands by itself. So I wouldn't put it anywhere in that category. But for sure, it could help eventually for like pores, or for like a lot of times those ice pick scars. It can help shrink those. Hi, Zia Maria, how's it going? Good seeing you on again. We're talking about under eyes. I don't think that was the issue you had, but I'm happy to talk about every topic that I always work on. So just feel like, just because I have this photo up doesn't mean that we're only talking about that, by the way. So whatever guys are, want to ask, I'll be happy to go through. What did this patient have done? Actually, I used hyaluronic acid filler in this case. This was only with Restylane. It was with down to the bone, Restylane Lift, and then Restylane Classic underneath the eyes. It does, let's see here, what is the question here? I missed a few things here. What's your approach for large pores? So you really just want to control oil production really when it comes to pores. It's a matter of a lot of times of oil production. There may not be too much you could do outside of that, but if you have a lot of oil, then your pores do get a little bit more dilated. So things to control oil could be like tretinoin. It could be like oral medications like isotretinoin or Accutane, oral spironolactone. All those could potentially help a little bit with the pore size. But you'll see that a lot of people don't really, have long-term solutions for pores because oil sometimes can ebb and flow. It could shift. Sometimes people have their menstrual period a little bit that they're affected where it gets a little bit more oily, and then they may notice their pore size as enlarged at that point. What should I do for a lot of small closed bumps all over my forehead? The easiest thing to do would be just to pick up different cream. Just pick up different cream at the pharmacy like Target and use that. You can mix it with a little bit of a moisturizer initially and do that for about 2 weeks or so, and that should hopefully help prevent that purge that could sometimes happen. So that's what I usually recommend. Hi, I'm up. How's it going? Good seeing you on again too. Thanks for coming on. Is the Accure laser reducing the oil gland or eliminating? So it's, it is shrinking that oil gland. So it is shrinking it. It's not just completely destroying all the oil there that's in the skin. It's more just normalizing that oil. So very similar to the way Accutane works in terms of affecting oil glands. And it's just constantly targeting the oil, helping it shrink over time. There used to be some other options out there where just completely just nuke these oil glands, and you could run into a lot more problems with just overall just dryness in the future there. Stefano saying, I'm on Accutane 9 days in and purging is happening. What should I do for cystic purging? Well, are you using any other topical creams, like any exfoliants? Are you doing anything else like that? That's the first thing to make sure that you're not doing. Use a lot more moisturizer, and then also consider starting a zinc supplement too, and that could probably help you out there. But sometimes actually there's still a component where you have bacteria on the surface of your skin, and you have to do something for that bacteria. So something like dapsone could help out, or like topical clindamycin, so that may be an option there for you as well. Let's see here, 163.3 centimeters. I'm not sure what that is that a good size? I'm not sure. I'm not sure why that's on there as your screen name, but 163.3 centimeters is saying after Sculptra and Bellafill does lose its effects, do the scars sink back down? Well, if you end up actually losing your natural fat, then you will see some of that volume go as the volume goes down. You start to see some of those scars. A lot of times people will see that their scars get worse as they lost weight. That's very, very common. So yes, as you lose some of the volume from Sculptra, you may notice that your scars are a little bit more visible. But at least you had some support there. At least your skin quality got better. Bellafill is a little bit different because 20% of it, that PMMA, does continue to stay there. So as we get more and more correction there is always going to be a little bit of support there, which is really useful for patients, especially when it comes to scars. It's just that you may need a lot more than you may have expected, honestly. That's the biggest thing. And Bellafill is actually, it could have been an option for the under eye and the mid cheek, especially we place it in the mid cheek, and it helps lift up and support that area really, really well. I had 2 patients I did that on today, really, really nice. One patient who's a really long-standing patient of mine for the last 7 years or so, and she was concerned because she had a bit of malar edema, so it was like a little bit of swelling over here. And we can't place hyaluronic acid filler then because otherwise it'll just draw in water. So I did some Bellafill for her. It looks beautiful, just tiny little micro droplets of Bellafill. And that ended up just solving most of that issue there. So definitely, there's ways of solving these problems, and it doesn't have to involve the traditional fillers that, just draw in water, because you may run into more problems with that, especially in the under eye area. So things to look for, I was mentioning, like, let's talk about some of the things to pay attention to. So if you have pigmentation, or if you suspect you have pigmentation, you could really take a look and pull down your skin, pull down like your cheek over here, and see if that pigmentation is following the skin. Basically, is following that tension. And you could then tell that that is true pigmentation, and you likely need to do something like the Pico laser for that, or something else for like skin brightening, like a Q switch or a Pico laser. I use Pico laser in my practice. Some people use Q switch. I like Pico because I could do it in all skin types, less chance of rebound pigmentation. But I understand that people have access to different lasers, and so Q switch could be another idea. But it works really well, and then it also can help tighten the skin. Other things to test for is to see how much laxity there is. So you can do something called a pinch test. You basically pinch your skin and see how well it snaps back, and don't hurt people. Actually, I kind of was embarrassed to say, but like a couple times I did actually, when I was testing it, I did pinch a little bit and was like, oh, there's a lot of skin over here, and I realized it did kind of snap back a little bit, like it almost hurt a patient there. And I was like, I got to be really, really gentle when I'm pinching these for the test, so that way we could determine if we could do a laser or if we should do just surgery. Because usually a lot of times, especially if there's a lot of laxity and it takes a long time for it to flatten back, we just have to do surgery. I have my partner just take care of that, and she's excellent with it. And it's a pinch. Blepharoplasty, you could just do that just in the office, so it's no big deal, just right there, and pretty good, because it's just a quick change on your under eye area, which is bothering people so long. Brianna is saying, I have really red cheeks that just look like a butterfly rash. Not sure what it is or how to help it. Well, okay, so butterfly rash classically is associated with lupus. I'm not saying that's what you have, but I'm just saying that like that term butterfly rash is classically with lupus. So I'm not sure if you have other symptoms of lupus or anything like that, but that's something just the fact that you're mentioning the word butterfly rash, that phrase, that's just like a classic thing for lupus. But likely it's also the other reasons potentially, which could be that it may be for rosacea, or if you had some other irritants, things like that. It's tough to say without seeing you, but if it's just like on its own coming out, and there may be other other autoimmune conditions that you're working up or worried about, then potentially lupus, which is something that a lot of times is misdiagnosed and missed a lot. It's like classically missed. Lupus is just, something that a lot of people kind of have in the back of their mind, but almost never want to admit that it could be the case. And it's possible, for some people, especially if you're saying those classic terms. But again, I don't know who you are or anything like that, or what you look like, but it's something to pay attention to. Chico's saying, does Tazarac help PIE fade and make skin smoother? It helps a little bit with the PIE, I would say a little bit, but it's a bit more irritating than I may like for that. So I usually would recommend more like a topical azelaic acid, like 10% azelaic acid, just over the counter is easy, 15% if you want as well. But that's usually what I would recommend for that. But if it really is truly stuck, like those little tiny vessels are stuck, then you may actually have to do something where you use a vascular laser, like XLV could work well, and you could just target those direct little vessels there. Hey Islio saying, does scar remodeling help with releasing where there's dimpling occurring in the skin? Yeah, that's a perfect question, actually. I love that question, actually. Yes, that's the whole point of doing subcision. And it's really like when you're looking at patients, and what I always do, everybody that knows me and come to me knows that I'm always having you animate. I'm always having you like smile. And as you're smiling, I'm feeling your skin, feeling how it's bending and folding. And I could tell where the tether bonds are. And it's not true. I had a bunch of people that had commented on some of my videos, and I saw those, and I said I'll respond on live. Some people had said, is it that you always hear that crunching noise whenever you go underneath the skin? No, that's not the case. In fact, the patients that I worked on today that didn't have scars, where I was using some areas with the cannula, for example, there's no crunching sound. There's nothing that we're doing with that. And it's you don't feel the same kind of fibrous bonds that you would with when you're doing subcision. So very, very different, feel really of the skin. And when you're looking at the skin, you can see a lot of times that there's areas where it's pulled down. And those are areas where we first want to break up that scar tissue, help release that bond, and then you could place something to give it a little bit of volume later on. And that could be like Bellafill or Radiesse, Sculptra, something like that. hyaluronic acid filler, whatever it is, we gotta do something for that volume, basically. Restylane Supply Company is saying, how long does Bellafill last for acne scars? Well, Bellafill, really, it's 80% cow collagen, 20% PMMA. That PMMA could continue to actually just stay in your skin and support the scar. We know at least for 5 years. I've been doing it for a lot longer than that. It lasts a lot longer than that for me. There's no real evidence that that it breaks down, which is nice because if you play, I place it very carefully. I'm definitely the top 1% of Bellafill. At one point, I was number 2 in the country, they said, for the amount that I've done. I don't know if that's still the statistic. Now they're telling me I'm top 1%, so maybe I'm not like the number 2 person that uses it anymore. But it was like interesting because the only person at one point that was like ahead of me was like a guy that was doing a bunch of like Bellafill butt lifts and stuff like that. And I was the only person that was doing it on the face. And I just don't run into any problems with it. It's just very, very safe for me. And, I dissolve so much filler in my area. I see so many more complications with HA filler than, especially like particular certain brands of HA filler, than I ever do with something like Bellafill. Parse Med, good seeing you on again. Dr. Qazi, do you recommend filler for jawline augmentation in men, and will there be sagging and spreading? Really good question. So, I mean, my jawline has filler in there. I love it. It's awesome for me. I really do. It's one of my favorite things in the world. And I did hyaluronic acid filler as well as Bellafill. And the reason why I did both of those is because I wanted a little bit more support, something to lift it up a little bit more. And then the Bellafill is good for collagen, for that skin tightening effect, and just improving the skin quality over there. And it's really amazing actually, because I felt that, like I was talking about that skin test, I did find before that there was a little bit more laxity, and now it's like it just snaps right back, which is cool. So I like that. So yeah, I'm a big fan of jawline filler, chin filler in really all patients. And the way I would do it for men is different than I would for women. Like for men, really, especially if they're open to it, and their overall bone structures can support it, then try to go a little bit wider and try to go towards a little bit closer towards that 90-degree angle for them. And for women, it's a lot more subtle. I'm actually very, very subtle with that. I try to just go underneath a bit of the jawline, just supporting a bit of the jaw. And in fact, actually it could help with jowling, because if you notice actually, and you pull back a little bit of your skin over here, it could be one of the few areas that does support the jowls. And so you may notice less jowling with that. So yeah, it's a great question. I mean, I am a big believer in it, really. So is it safe to try any type of laser treatments if I've done Bellafill treatments before? Yeah, absolutely. I do laser treatments like every 6 months, and I have a lot of Bellafill. User 31 saying, my scars are looking good. Dr. Q is the only one who could do this. So worth the travel. Appreciate you, User 31. But I hope I could share your photo, please, or at least let me know who you are, because that's awesome. Thank you so much for coming on and telling me. Which part of the country are you from, by the way? How is Sculptra used for acne scars? So good question. It's more for collagen stimulation, but you could do it also for a little bit of volume. So those areas where there's pockets of fat loss, you could place them in there and help lift up the scars. How does everybody know Dexter nowadays? Has Dexter made a big surge back? I loved Dexter back in the day, but I didn't realize that like everybody lately has been talking about Dexter now. Is he like back now? That show, everyone like comments and says, I look like Brian Moser, which, I don't know if he was the greatest character on Dexter, but it was a good show though, at least. Is it safe to do any type of laser treatments if I've done Bellafill treatments before? Yeah, that's absolutely, I answered that one actually already. Yes, it absolutely is. I guess you repeated that though, but I have no problem with saying that there is no problem with doing lasers when you do Bellafill. It's not going to melt. It's PMMA is not going to melt in your skin. It's going to be, depending on where you place it in there, hopefully the person does it in a very good spot, which is supporting the skin and supporting the structure, and you really won't run into problems there. Elite with Brianna saying, as an esthetician, what are treatments that can actually improve skin under our scope? Good question. I mean, it depends on what kind of scarring you have. Depends on what's happening with you. If it is true, acne scarring, or if it's like more just like minimal, pores. Those are all like questions that we should be asking. But true acne scarring is very, very difficult to get significant improvement with minimally invasive procedures like microneedling or topical peels that are going to be in your purview. But there's of course things that you could do that like could help brighten the skin. So something like a modified Jessner's peel, for example, things like that could possibly help you, but it's not going to be really, enough for like true scarring. But, for a little pigmentation, things like that, absolutely. And, it's like the thing is, I have no problem with people going to facials or getting facials. But I have seen, because I do so many scars, I have seen so many times like little nail marks around the scar that was there. And so basically they had, a pimple, some sort of cystic lesion, and that they tell me that they went to estheticians that were doing facials and they were doing extractions, and you can see nail marks there. So there's, a lot of concern that I have with that too, because I find that people are doing it with too much force, and they sometimes are scarring people a lot worse. That original scar would have been bad enough. Now you have a nail mark around the scar because the esthetician did extractions there like that, and it could be really problematic there. And so things to pay attention to, I agree that there's nice to do like light little peels, things like that. That's all fine, but sometimes people just do too harsh. The estheticians do, and you can run into a lot more problems. The other thing that I don't like, and I've said this, I was talking about this yesterday as well, is that I don't like the fact that a lot of times, it's not just estheticians, it's also physicians and nurses and PAs that will make these promises that you could solve these scars and it'll be like 70-90% improvement with these minimally invasive procedures, things like that. And it's really unfortunate, honestly. It really is unfortunate. Zia Mara is saying, I can't wait to see you and touch my skin. I know you'll make magic happen. I appreciate you. I know it's going to be a long journey, but I love the fact that you're open to the fact that it's going to be a long journey. And actually, I wish, I don't have the ability to share your photo, but maybe you could, so I could do it next week. If you could show your photos actually to me, that'll be really great. I had your video that I saw. Everybody should see your video, by the way. If you haven't seen the video, go to Zia Marie's page. Take a look at her video. You can see her skin, her kind of skin. And if you do, I could go through kind of right now a little bit about what's going on with her skin. A very, very severe cystic acne, and that really, she said that when she was 8 years old, she was telling us that when she was 8 years old, she had cystic acne, and very, very deep scars. So it is worth like looking at that. And so if you could, all of you guys want to take a look and see her page at some point, you can see the kind of scar she has and like how it affected her. And then also I could give you an idea of like different things that potentially could help with those kind of scars. I showed actually on, we had a video on our page. You can see sort of similar scars. I wouldn't say it's exactly the same, but we have a patient sort of similar fits, sort of similar type of scars. He had very, very deep ice pick scars and boxcar scars, lots of volume loss. And you can see with excisions and TCA cross and some volume, how we improved it. So that's really a lot of times what we would need to do is more manual type of work, break up the scar tissue, do TCA cross, do excisions. Those are the things that are going to be really valuable for a lot of patients with ice pick scars, and especially patients who have more pigmentation. We got to be very, very careful making sure that we don't cause severe pigmentation issues. Where can you ask questions? You can ask me right now. You guys right now. How do you spell Zia Mara? Okay, so how do we spell Zia Mara? There's Zia Mara's. Okay, so Zia Mara is XIOMARA.MARIE on TikTok. And it was a really interesting video. I don't know if you had that video on IG or not, or on YouTube or anything like that, but that's where everybody was tagging me. It was on TikTok, and it was a really good video. And so at some point, just send me some photos, and maybe we could talk about that, because very, very serious scars that I know that you're not the only person suffering from those scars. I can tell you that. You're not the only person, and it feels like it though, it does, but like there's a lot of people who suffer from scars, and it's worth everybody just kind of understanding what people go through and understanding that you're not alone really there. What did this woman get done? This person, what we did was a straight filler. This is a straightforward filler. We did cheek filler, and then we did under eye filler. Really easy, just quick, I mean, it wasn't super quick, maybe like 15 minutes, but like it was quick. we ended up, you could see like just significant improvement there. So I thought this would be kind of nice because I talk a lot about scars and everything else, but as this last couple of weeks, a lot of people were saying that they were worried. Some people were saying because they were on these GLP-1 inhibitors, like things like Ozempic and what else, semaglutide, Ozempic. And so it's like sometimes they lost a little bit of volume, lost a little bit of weight, and they started to notice a sunken in look. And they want to know what to do with this stuff. And, it's nice to be able to have some option for the right patient to look at. This patient's skin quality is excellent, so it's perfect to do filler with her. Otherwise, it's just, you may have to do other types of treatments, lasers, things like that. Do you plan on opening offices in other states? No, it's just like right here, it's perfect for me because my team is just awesome. And there's so much to do with it. Like there's so much involved with running this. And that's why I just don't do too many other things. I try to just focus on a few things because it's just like, I got to do it really, really well in order to do stuff. Like it's just, that's how it is. So I don't want to be the kind of person that runs around a bunch of places and I also like the fact that I could see people in one spot again, they know like the staff, they know the team, they know like the rooms, everything like that. It's just like very comfortable. And like, there's a lot of anxiety and emotions that come with this stuff. So it's like, I like that. It's just like everything's continuous. My opinion on dermabrasion for acne scarring. Good question. It's okay in the right fits 1 through 4. Yes, it's doable. The reason why I'm saying that it's okay is because I think that the CO2 laser, if you're doing it with a surgical handpiece, is superior to it. I think that's it's more precise for what you need to do. But I do dermabrasion. I actually had a really good case on last week, I guess it was, but a really, really good case. And it's a bloodier procedure. It's like it's invasive procedure. Really, for those who don't know what dermabrasion is, we're sanding down the scars manually, like physically sanding it down. I don't really use those tools. Like I know some people use power tools and they're just like drilling it down that way. I think it's really high risk when you're doing those tools, maybe for like small little spots possibly, but there is more risk of hypopigmentation that way. So instead I usually use more of just things that I can sand it down with other types of sandpaper, sterile sandpaper, things like that is what I use. Or other tools that I could just really sand edges of scars. And in this case, for that patient, I did it the day after I did his phenol peel. And the reason why is because I wanted to be able to get to another layer safely. So I basically did the phenol, and then the next day sanded all this down and then did another layer of the phenol. And we actually, yesterday, I guess was it? Just yesterday, we unwrapped him and it looks amazing already. So it's good. I think it's gonna be awesome, a really beautiful result. Let's see here. Thank you so much, Maine, by the way, for coming on and tagging people to come in here. I appreciate you for sharing. You could just, Ziomara, you could actually just, I guess you could send it over to info@qaziclinic.com. You can also DM us over here through here on this page, but you could do it through info@qaziclinic.com. Caldwell Cutie saying, do the acid peels work to reduce lighter scarring? Yeah, depending on what kind of scarring you have and the depth of your scar, things like that. Yes, we could just do an acid peel, so something like TCA peel or a phenol peel, but it depends on how serious, how thick your scars are. CEO saying, how dangerous is a phenol? So a good question. I mean, things with the phenol is that we want to make sure that you're fit enough to do it. So you got to make sure that the patient's EKG is normal, that the blood work is normal, that the medications aren't going to interact with the phenol. And certain medications could, we want to avoid medications that are going to elevate potassium levels during that time, things like that. So you got to go through all that, double check it. If it's okay, perfect. Then after you do that, then when we do the phenol, we're going to do it in a surgery center. So that way I have the anesthesiologist monitoring the heart, everything like that, and adjusting pain medications. But I also need to make sure that the patient's skin type is safe for it too. So I do it through Fitzpatrick 1 through 4 because it's a lot safer to do it that way, or I should say that there's a lot less risk of hypopigmentation with that skin type. But there's still a concern that, and so we have to walk through to see, are your scars severe enough for us to be doing those type of things. Let's see, user 65 saying, hello doctor, what does help with post-surgery eyelid scar? Yeah, it's a tough one because with that, a lot of times you either have to do a revision surgery or you may have to do something, in the meantime, something like low-level lasers like an erbium laser could help. Up is saying, is SPF 46 sufficient? That's currently what the sunscreen I've been using has. Yeah, that's perfectly fine. I'm glad you're doing sunscreen. That's the biggest thing there. Does Radiesse help tighten the neck? Yeah, it definitely does. It's really good for the neck, actually. It's awesome because it actually stimulates elastin production. It's really nice for giving a little bit of volume, but stimulating elastin, collagen works really well for that. Main, thank you so much again for all the great comments. Really appreciate you guys. Sura is saying, how's Cosmo and Peel? I'm a brown girl and have a lot of acne marks. We're, I think, actually the only practice that is allowed to actually use a pharmacy through Aesthetic, which is the official distributor of Cosmon, that we could actually put additional medications in there for more skin lightening. As far as I understand, they told me last time I talked to them just a couple months ago, and they said that we're the only practice that's allowed to do that. So if you hear of other people that are using MD, things like that, it's questionable because, you know, as far as they told me that we're the only people that are allowed to be this MD level for Cosmon. And for some patients, that is an excellent option, especially for people that you said you're a darker skin type, and we want to help pick up some of that pigmentation. It's excellent for some of that. Then we can also combine that with like the Pico laser, for example, other things, but Cosmon could be excellent for that option. Is it okay to do it at home? Well, you definitely need to do a consultation with it. It is prescription strength, and then we have to determine what strength we should be using for you. It is safe though for us to to help you out with with a double check to see what strength we're doing, what depth we're doing with the peel. So then we can determine if it's okay to do it at home. Dina is saying, what do you recommend for under eyes to fix the loss of volume? So that's, that's what this case was. This was with Restylane Classic and Restylane Lift, Restylane Classic underneath the eyes, Restylane Lift in the mid-cheek area. That worked incredibly well for her. Beautiful, immediate result. Maho is saying, clear and brilliant versus microneedling. Good question, actually. I'm not sure if you're referring to scars. My patient today had 10 clear and brilliant sessions. It did nothing. Another one had 2 clear and brilliant sessions. It did nothing. I had another patient who did 12 clear and brilliant sessions. It did nothing. So I think you're seeing a trend here. And I would say that more people have said that they've had a little bit of improvement with microneedling, just like, low cost microneedling than they have with clear and brilliant with scars. So take that for what it is. I've had a lot of patients, a lot of people who have done multiple times with clear and brilliant, and they found that it was really ineffective for the scars. And it's really unfortunate that to this day, right now, in the year 2025, it's still being pushed for scars. It's just like ridiculous. And you could do, like I just said, 10 sessions. Some patients, there's been patients that have done up to almost 20 sessions. I had a patient like 3 months ago or so, I was talking to you guys about. He actually came on one time and he was just like 20 sessions of clear and brilliant, and it didn't do much. So it's like someone made a lot of money off of him, I can tell you that. And all he had to do was a couple sessions with me and we solved his scars. And he did so much with that. He said it was like $7,000 to $10,000, something like that he spent. Crazy amount. And unfortunately, it didn't improve his scars. Let's see here. Caldwell Cutie saying, if you're going to have a rhinoplasty, should you wait until after the surgery to get face fillers? Yeah, that's usually a good idea because you don't want to cause excess swelling in your face. After rhinoplasty, you're going to get a lot of bruising, a lot of swelling, and it could draw in some more water in that area. That being said, it does go down, but it may be a little bit uncomfortable for that. Why filler versus PRP for the under eye? A good question. In fact, this patient would have been a great person also to do PRP in the future, but she had true volume loss. So true volume loss, we have to do something for that, and that's going to be like actual volume, and in this case we use hyaluronic acid filler as that product to actually lift up and improve that volume loss. But if it is just a matter of venous congestion, you want some new blood flow, then PRP could be an idea. What are your thoughts on PRP microneedling for small acne scars? Well, if it's really small, maybe, but I've also been telling people, really important to know, I see a lot of people who have done it for ice pick scars and it stretches the scar out, so it makes it a little bit wider. So 20 sessions of Clear and Brilliant before. Yeah, 20 sessions of Clear and Brilliant, and they said it was just ineffective for their scars. I've heard more people say that the microneedling helped a little bit more than I've ever heard people say that Clear and Brilliant helped for their scars. Just take that for what it is. And a lot of patients, a lot of people have tried so many different things before they come to me, and it's like, I hear all the stories. I'm like, I know which lasers they've done. I know what all these things, the devices, all the people they've gone to, everything. And so I hear it all, and I'm very aware of like the things that potentially worked and didn't work for them. And a recurring theme is really with that particular device that did not work for their scars. And so that's unfortunate. Let's see here. Do you have any patients? Oh, Lucky Singh is saying, do you have any patients who have extreme sensitivity to all the treatments? What are the options for them in regards to further treatments? Extreme sensitivity, I guess you have to clarify what you mean by extreme sensitivity. Do you mean pain, or do you mean that they get more redness? What are you referring to with that? What exactly is Clear and Brilliant good for? So it's funny actually. So for fits 1 through 3, it's basically fine for like some pigmentation as a light resurfacing laser for that. Fits 1 through 3. Notice though, fits 1 through 3. So it's kind of interesting, right? When you hear it being done on patients, even African patients, fit 6 patients sometimes, it's, it's suspect. It's really, really suspect that that's being pushed sometimes. And so, yeah, and it's interesting. Sometimes I've heard that, that the person will promise that they'll get this kind of improvement with their scars and all that kind of stuff. On an African skin type, they're doing like that type of thing, and it's really unfortunate. So fits 1 through 3, so meaning mostly like European, Northern European descent, and like, and they're doing it still on Asian patients. They're doing it, and this other thing is, I've said it before too, that a lot of people get very confused about East Asian skin type. They think that you could just bulk heat the skin because a lot, especially like Korean patients, could be lighter skin type, and they assume that they're not going to have pigmentation. They're so wrong, and they cause severe problems a lot of times, like a terrible PIH. And it's like, very questionable, the fact that they didn't understand that you can't use these energy devices at that heat and that energy. But a lot of it's because just when they designed these scales, they didn't include certain skin types. They just didn't have that. They didn't know. I don't even think, Native Americans are someone that also confuses people a lot of times. Native American skin type is actually more similar to East Asian skin type. Probably when a lot of came across the land bridge 20,000 years ago or so. So it's like very similar. You treat it very similar. Like it'll be like if you put too much heat and too much energy there, they will get a lot more pigmentation. So you gotta be very, very careful. And if you're not aware of these things, it's like you could really run into a lot of trouble and a lot of burdens, and really cause a lot of severe pigmentation issues. And that's what we see a lot of times, and that's what, like, I deal so much with pain, with burns and things like that. And so it's like the last thing I want is for people to go out there in the world and go to somebody who's doing these type of treatments on darker skin types, or like if you're Asian and they're doing it on your skin type with the wrong settings, the wrong devices, it can be really, really problematic. Lucky Singh is saying, yes, that there may be pain from past treatments. If the skin is so tender, what are the treatment options? Well, pain can still be managed. I mean, there's so many different things to control and manage pain. So it'd be really unusual, especially for scar treatments. I mean, there's so many things that we could do for pain to control it, that I would say that that's not going to be the real actual issue. Some people actually experience what seems like pain, but actually it's more anxiety. And if it is truly anxiety, then we have to talk about that. We have to actually look and see, if we should use the Pronax, or if we should give you an anti-anxiety medication, something like that beforehand. So we should see. Lee is saying, does having Ehlers-Danlos affect the ability to use any lasers? So for those who don't know, that's a connective tissue disorder. A lot of times you can see a little bit more flexibility in like the joints, although not always, but that does, and sometimes you may see what looks like a lot more laxity in the skin. So no, that doesn't actually affect the ability to use any lasers. It's just when it comes to the healing process, I'm going to be very careful with the kind of heat, the kind of energy that we're going to use, so to heal without like excess tissue contraction or more scarring or anything like that. So usually I'm not trying to bulk heat the skin with that condition. That's interesting that you said that you you have, or I'm assuming you have Ehlers-Danlos syndrome, because it's kind of interesting because it was a diagnosis that was missed for a long time. But I'm starting to notice over the last like a year and a half, it's been like appropriately diagnosed. Interestingly enough, I feel like there's been, with the younger generation of physicians, maybe something like that happened there, or people are just aware of it now, and a lot more people have it than, Ali is saying that a lot more, it's way more common than people think. It was way more common, and it was, again, one of those diagnoses that was just missed a lot. People didn't do, we were talking about that yesterday, that how people just don't do physical exams. And a lot of these things are missed because you have to do a physical exam for these type of things. So it's interesting that a condition like that was missed for so long, and now we're starting to see it, like a lot more people are like properly diagnosed, which is awesome. It's a connective tissue disorder. So basically, a lot of times people will have a lot more flexibility. Or they will say, well, it's, like you look at their elbow and the elbow pops up and it looks almost like what's called double jointed, like that, like it pops up like that. And it's not that just because you're double jointed you have that, but like it's just a sign, though, another sign for it, though. Anyway, so thank you guys so much. I'm over my time for tonight that I usually spend. Although yesterday I spent a lot longer, but I'm going to be off for until Monday. So feel free to keep asking the questions, send me the DMs. I love all the things. I usually get to them eventually. I'm busy during the day, so I haven't really been able to make actual content. This works out for me because I can just answer the questions through here. So if you have questions, feel free to come back on here and I'll be able to help you out with that, though. And yes, Marie, please send me the photos then if you could. Appreciate you sending it on IG, which is awesome. Thank you so much. And we'll go through your case next week, actually, if it's okay with you. If you let me know, we'll get it. We'll text it back to you, and then I'll go through. I know you're all the way in Philadelphia, and I'll be happy to help you out though one day. And in the meantime, we'll go through it all. So maybe I'll try to do that on Monday. So let's go through it. Actually, let's shoot for that. Marie's case. Everybody should look at her video and just see how severe her scars are. We're going to walk through how we would solve that, and expectations, how long it will take, and other things like in terms of like making sure that we can maximize that collagen response, because with her skin type, we really want to make sure that we maximize collagen. So we'll talk about that next week. Awesome, Marie. We're hearing that she's going to be able to do that for us next week. So that's awesome. Let's come on next week then.